Hi, it's Diane again with Allied Health Career Training. Welcome back. So, in Unit 8, it is talking about some special procedures in emergency care with your client. A few things I want to go over with you on this. One is you will certainly from time to time have some clients that have a prosthesis or a brace or a cast of some type. I can tell you as a wound nurse, this is one of the main ways that wounds get started is from a prosthesis, a brace, or a cast. Think about it. It is something foreign that is up against their skin and they are putting pressure on it. It can rub, and lots of times the reason they have had an amputation is because of perhaps diabetes, and they probably have had some neuropathy, and so they may not have all their feeling in that limb where that happened, and so they may not be able to tell that it is causing a wound. One of the most important things, if your client has a cast, a splint, or a prosthesis of any kind, is to observe the skin. Look at that. Look for signs of redness. Look to see what it looks like. Is it changing? Does it look different? Report those findings. It is so important. Those folks who have had an amputation, they do not heal as well from that stump. And so if it breaks down, trying to get it to heal is very difficult. Not only that, but now they can't wear that prosthesis. How do they get around? It has really complicated their life. So much better an ounce of prevention, don't you think? So always keep an eye on that. Sometimes they don't want to wear their splint, their brace, their cast, or their prosthesis, or whatever correctly. Always encourage that. Also look at it. Make sure it's being cleaned, well kept, and that nothing is wearing down on the inside, or there isn't any kind of I had a client once that actually got on the inside of a brace, it was kind of a fuzzy material, and somehow they got a little cockle burr in it. She kept saying, there's something irritating, itching me in there, and she would put a pencil down in there to scratch it. I took it off and I see this little cockle burr in there. I'm like, oh my gosh, I guess there was. You know, and so there's so many different possibilities that can happen. Make sure you look at that every time you're there. I think that's really important. So let's talk about something else here, and that is fire. Fire can happen. It is a real danger, and it's especially so if they are on oxygen. You know, I had a very beautiful little couple, and they were both on oxygen, and they had, you know, the little E-tanks, and I was checking to see if they needed to get those filled, and I said, where are they? And well, they had had company, and their daughter came over to help them clean, and they said, well, I'm not sure. I think she put them in that closet over there. And I opened the closet, and well, yep, they were there. You know what else was in the closet? Yeah, the hot water heater. A gas hot water heater that has a flame, you know, and the oxygen was being stored next to it, and not a good thing. So because this is compressed oxygen. Oxygen supports combustion, and there's a flame. Not a good pairing there. So you never know. Always make sure they understand that oxygen has to be stored in a holder, in a container, a holder of some type, away from a furnace, away from any kind of flame, smoking, fireplace, hot water heater, anything like that. It can't be stored next to that. Not everybody realizes that. Okay, so that is something to be mindful of, certainly. Another thing is smoke detectors. Do they have one? Does it work? You can always push the button, and check. They may not have changed that battery in 20 years. They're hard, if he's 90 years old, do you think he got up on that ladder and put a new battery in? Probably not. Might be something to look into. Another thing is have a plan. Do they know how they would get out of the house? What their plan is if there was a fire? Those kind of things. Look for cords that are frayed. Any kind of electrical hazard as well. I would like to talk a little bit about oxygen as well. I have a video on oxygen that you've probably watched already. Another thing I would like to bring up regarding the oxygen is the oxygen tube itself is a trip hazard. I've seen some people have 30-foot oxygen tubing, 50, 100 feet of oxygen tubing. That can get wrapped around themselves and it can be a real trip hazard. So watch that. Also, they make some really cool oxygen tubes now. You've probably seen the lime green ones. There's some that are even glow in the dark. I think that's really neat. That way they can see it and not stumble over it. So there are some things that can help that. Remember, oxygen is considered a drug, and you want to be careful with that. You can't just turn it up. It is a prescribed amount that it needs to be kept at. If they turn it up themselves when you're gone, you can't help that, but you shouldn't turn it up higher than what the ordered liter amount is. Okay, obstructed airway and choking. Everybody's heard of the Heimlich. Now we call it the abdominal thrust. And you probably have had BLS CPR. You should if you're working in someone's home. I am not going to go over big details because it changes every year or two. The American Heart Association changes it almost every year or two. But I will give you some points. Never call for help if they're choking. Of course, yell. But if they're choking, don't run to the phone and dial 911 as they are choking. You need to get in there and do the abdominal thrust. Because once they go unconscious, now it's really difficult. So immediately when they start choking, if they're can't get their breath in and out, if they're coughing and coughing and coughing, that's great. Encourage them to cough. But if they're just making tiny little whistling noises or they can't breathe at all, you need to get in there and do that abdominal thrust. And remember, it comes around like this. You form and you go in and a little up as hard as you can. Might you break some ribs? You might. But better a couple broken ribs than dead, right? Life over limb. So probably you won't, and it's okay. Don't be afraid of that. What you need to be afraid of is not doing it hard enough where you can launch that whatever's obstructing their airflow out. Because if you don't do it hard enough and just a little bit of air sneaks by but not with enough force to launch it, after you do that a couple times and it's not working, then you do it really hard, there's not enough air left in the lungs to cause the pressure to force it out. So if you're gonna do it like you mean it and get it done, okay? All right. Remember on a baby, what they say is, and I'll show you when in the unit where we go over mother and baby, how you put your hand there and you turn them this way and you do the back thrusts. but always support that chin neck. Okay, always remember that when you're doing an abdominal thrust with an infant. All right, diabetic emergency. I have a video on diabetes that you should have watched by now. Remember, a diabetic emergency is when the blood sugar goes too low. Either they didn't eat or they didn't eat enough to match the amount of insulin or anti-diabetic medication that they took, or they ate plenty but then they vomited, or their amount of activity was greater, they were burning through the food faster at a higher rate than the amount of food that they took on. Okay, so that's why they go hypoglycemic, because normally they would be hyper, have too much blood sugar. Anyway, at any rate, they'll be wet and wild and crazy. And if that's the case, you need to get some quick glucose in them. And remember, you don't need a big old 2 liter of pop. It's just a couple ounces, maybe 3-4 ounces of quick sugar. Quick, like Coca-Cola, like orange juice, like cubes of sugar, like honey. Something like that, that'll get in the bloodstream like that. Just enough to bring it up. And then you can't walk away. Remember, you have to do a complex carbohydrate with a protein. So like half a peanut butter and jelly sandwich would be great, you know, or whatever you're going to give them. Something to carry them on a little bit. And then when they feel like they can, then they need to eat their meal. All right. But I think my video explains that. But a hypoglycemic, it's a diabetic emergency. You have to take action. You have to take action right away. If they go unconscious, you do not put anything in their mouth. They can't swallow it, they'll choke. That's where the glucagon injection comes in. If you don't have one of those, if you've not been trained, you don't understand how to use that, call 911. Same with the abdominal thrust. If the abdominal thrust does not work and you've done everything you can, call 911 and start your CPR. If you know, you got to know what their advanced directives are, right? You got to know who's a DNR and who isn't. Now, just because someone's a DNR doesn't mean we don't do anything for them. If they fall and break their hip doesn't mean we're not going to fix the hip. What DNR means is if their heart stops, we're not going to give them CPR, okay? There can be other things in there with their advanced directives that you probably need to be aware of before you go to their house. The last one we are going to talk about today is what happens if you go to your client's house, they don't answer the door, and you knock and knock, they don't answer the door. You yell, they don't answer the door. You call your office, and they say, no, we just talked to his daughter, and he should be there. And you're like, he's not answering. So you look through a window, and you see him lying there, and it doesn't look good. Obviously, you would need to call 911. If you get into a client's home, let's say the door is open, and you go in, and you're saying, Joe, Joe, and you go in Mr. Jones' room or wherever, and there he is with no sign of life. You check for a pulse and breathing. There's no sign of life. Call your office, ask for directions on what to do, because it depends if he's DNR. It depends. DNR, remember, is do not resuscitate. So is he a DNR? Do we need to call the ambulance? What do we need to do? So I would call and make sure you understand what the directives are for each of your clients if you find yourself in that position. So all the things that can happen when you work home health. Nonetheless, I think you'll find it is very rewarding.